But this is where the problem arises with Lotus, because not only are the vast majority of meniscus injuries that I've seen medial meniscus, they happen to be medial meniscus of the left knee. Why would that be?
Second foot you put in.
It's the second foot you put into Lotus, exactly. You can protect the first knee by bringing it into full flexion. In fact, that's the way it is properly taught by most teachers who have had any kind of anatomical training. Make sure the knee is fully flexed before you do any kind of rotational movement to make sure it's always coming from the hip. You don't want to be yanking your knee joint into those rotational movements unless it's fully flexed.
But isn't that the key, is that if you are rotating from the hip, lateral rotation,
the knee is protected.
The knee is protected.
But only the first knee in Lotus. How on earth can you get, you want to come up and demonstrate. Come up. No, come on. You brought it up. You're in a Ashtanga. You do this all the time. Come on.
But I do it in the midst of a practice.
This is in the midst of a practice. It's the practice of exploring. You mean you're not warmed up?
Yeah.
Okay. Can you do this? You're very flexible.
Yeah,
okay, come.
She's a perfect example.
Because you can do it without using your hands, right? You can just flap your legs into full Lotus, right? Okay, come on.
But she has that lateral rotation in the femur, which
I don't care. I don't care. It's a question of mechanics, okay? Have a seat. Okay, so face the camera, please. There we go. Okay, so traditional practice of Lotus, you do right leg first, okay, and then that. Okay, clearly very flexible. This is most likely never going to be an issue for you. I hope it's never an issue for you. Okay, but let's slow that down a bit. Can you just come out of it? Okay, so now you're going to fully flex your right knee. Pull the heel right into your butt all the way. Good. And now keeping the knee fully flexed, put the foot on top of the other thigh. Okay, good. Now do the same thing with the left leg. Sit right, that moment right there, where she had to pull it out of flexion.
To get it around.
Right there, that's the moment. That's the moment right there. If you don't have enough flexibility in your hip joint, or if your cartilage is somehow just not cooperating, that one time, all it takes is one time, that's the moment when it's going to happen. Because you have to pull it out of full flexion to get it across the other shin if you're going to put it on top of that thigh. Right there. It cannot be in full flexion. The more open you are, the less it comes out of flexion, admittedly, but still there's that moment where it's vulnerable. And that's that. If it's going to happen, that's when it's going to happen. And if you're always doing the right leg first and the left leg second, that explains why, over the many years I've been doing this, I've seen many more left medial meniscus injuries in yoga practitioners than right. Thank you so much. Can you do it without your hands? Can you just flop it in using it?
If I'm like
super warmed up?
down.
Right, in your headstand or something, because gravity helps you. There you go. All right. Thank you very much. You can do it right side up. That was beautiful.
Well, I've never done it before.
Oh, well, there's always a new frontier to explore. Okay. But that's the Lotus dilemma. That is the Lotus dilemma. So the thing I usually say about it is the people that are flexible enough to do it don't really need to, and those that are too stiff shouldn't risk it. Therefore, I don't teach it. It's like skiing. The risk benefit ratio is way on the side of risk as far as I'm concerned. It's not worth it for me. Now, there's other people that would disagree, that talk about the benefits of Lotus and this and that, and I can't argue with that. I'm just saying that, and some people, were able to do Lotus when they were children, before they even took up yoga. They just have flexible hips, and it's like, you don't even think about it. And fine, that's great, but at a certain point, just because you can do something doesn't mean you should do something. And too often, the thing that tells us we shouldn't have done it is the injury we get from doing it. I'm just pointing out the mechanics of the thing. Take the information, use it as you will, okay? But at a certain point, the things that we were able to do as kids, as attached as we are to being able to continue to do them, there's other things in life that tend to get a little bit more important, like, you know, being able to walk, being able to function, you know, without pain. It's important.